Does your child have medical needs that need to be known, addressed, or supported at school? We're going to go over an individual healthcare plan. So, an individual healthcare plan is a school-based plan personalized for your child's specific needs while they are at school. And it usually goes inside of an IHP, an individual healthcare plan. Now, obviously, I'm in special ed. We're usually talking about special education, but this relates to your child who's in general ed, a 504, or special education. So, what goes inside of that healthcare plan? One, the student information. What is the student information? Their name, their birth date, and emergency contacts. Next, what are the medical diagnoses? A description of the student's medical condition, including any diagnosis from healthcare professionals. I think what's important here is often parents don't consider it or think it's important for the school to know if the student is not being dispensed medication at school. And that's not true. We want to know what's going on with any kiddo. Um, just having a medical diagnosis, if it rises to the level of dispensing medicine at home, they might need increased hydration, they might need increased protein, they might need increased breaks because they're hydrating so much they need tube restrooms. So we need to have that information. Healthcare provider information. Who is the student's doctor? If there's a medical protocol, if the nurse or the nurse practitioner or the team is assisting the student, and that student has needs or clarification needed from the medical um, 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 person that the doctor gave the school. And the doctor's orders. Next, goals and objectives. Sometimes in a healthcare plan, we have goals and objectives. I have kiddos that have healthcare plans that are type 1 diabetic, and they have a lot of needs that arise throughout the instructional day. And so maybe we have some goals from going to the nurse supporting that student, or maybe the teacher supporting that student, whether it's checking the Dexcom or knowing it's time to dose, or what are your levels before testing. We're going to have those. We train that student to learn to self-manage those pieces. Medical administration. So, does your child have allergies? What would we do in an emergency situation? Does your child have an extended medicine that's released at school or dispensed at school? Any medical information that needs to be known by the nursing team. Roles and responsibilities. We have this question come up all the time. We have kiddos that have a G tube, for instance, and require additional feeding, sometimes a bolus feed. Sometimes students get food from the cafeteria and they're not really in the norm and average range of eating their calories during the day. So then that nursing team measures and quantifies the amount of food that's left over, calculates those calories, and then whatever the balance is, delivers those calories in an additional G tube feed or a bowl feed. Communication plan. We got to have a communication plan, just like any other educational plan. Your medical needs are included in that. So, is there a communication log that goes to private nursing? Is there a log that goes back home to parent? Like we talked about, if they're missing caloric intake, what is that communication plan between the school and home? Review and update the schedule. So every year, every instructional year, even if your child's medical needs are the same and they haven't changed, we still need to provide updated medical orders at the beginning of the instructional year. So I tell every family that I have, July 1st of this instructional year, 2024, we need an updated letter from the doctor so that we can provide that to the school-based members and make sure that that IHP is in the nurse's office, but that it's also, if they have a 504, it's attached to the 504, and if they have an individualized education program, it's also attached to that. And of course, consent and acknowledgments. We want to make sure that the parent has consented to the plan, the parents heard the plan and is agreement with the plan, that's appropriate for the student's unique circumstances. Remember, we get it right for the child, we get it right for everybody. Make sure that your child, if they have medical needs while they're at school, are captured in an individualized healthcare